look says a lot about you, and sometimes what is being said isn't necessarily accurate. The aging process changes your body and face relentlessly and without mercy, and sometimes causes you to look tired, sad, and older than you really feel. This can cause you to feel differently about yourself and affect the way others might see you. Many factors that contribute to the loss of the youthful appearance include heredity, gravity, environmental conditions, and stress. Firmness in the skin and tissue is lost over time, resulting in expression lines and wrinkles. A facelift procedure addresses these areas and helps rejuvenate you by returning you to a more youthful, relaxed, and happy appearance. A facelift, or rhytidectomy, is a surgical procedure that reduces visible signs of aging in the face and neck by repositioning the underlying musculature and tissues of the face, redistributing or reducing facial fat, and reducing excess sagging skin. This program presents an overview of rhytidectomy, or facelift surgery. It is not a substitute for a complete consultation with a plastic surgeon. A complete consultation will include the discussion of your goals and expectations for the procedure, an evaluation of your specific situation, a recommended course of treatment, and a discussion of potential risks and complications. Any questions and concerns should be addressed during the consultation. Full disclosure of your health history is important to your safety. This includes any history of medical conditions or illnesses in your family, your current use of any medications, vitamins, herbal supplements, as well as any alcohol, tobacco, or drug use. Facelift surgery is best performed on healthy adult men and women who feel their outward appearance no longer reflects the emotional and physical youth and energy they feel inside. Good candidates should have no life-threatening illnesses or medical conditions that could impair healing. A positive outlook and reasonable expectations are also important. Certain conditions may preclude you from or require special precautions during the procedures. These conditions include cardiovascular disease, high blood pressure, or certain other circulatory disorders and diabetes. Patients who smoke are at increased risk of poor healing. They are advised to stop smoking for several weeks before and after surgery. Prior to your procedure, you will be asked to sign informed consent documents. These are used to make sure you fully understand the procedure, including any risks and complications, and that you commit to following any and all instructions you are given. These include pre-surgical considerations, day of surgery instructions, and information relating to the use of anesthesia. Facelift surgery is often performed along with other rejuvenative surgical procedures like brow lifts and eyelid surgery. Multiple procedures will increase the length and complexity of the surgery as well as the risk of complications. This should be discussed carefully with your surgeon. Botulinum injections, such as Botox, may be recommended prior to surgery in order to relax underlying muscles prior to their repositioning and tightening. Further injections may be suggested following surgery to help maintain results. A facelift does not change your fundamental appearance and does not stop the aging process. Following a facelift, aging will continue naturally. However, as you age in the future, you should always look younger than you would if you had not undergone a facelift. The facelift procedure begins with an incision on each side of the face, just inside the hairline at the temples, and extends down just inside the front of the ear and around the earlobe. It then continues upward behind the ear, ending horizontally in the lower scalp. The incision may not be continuous, varying based on the areas of the face to be treated, the amount of excess skin to be reduced, and the shape of your hairline. Through the incisions, underlying facial muscle, fascia, fat, and other tissue is repositioned or removed to restore a more youthful, uplifted appearance to the face and neck. If necessary, a second incision may be made under the chin to further improve the neck. Skin is redraped over the uplifted and rejuvenated contours, and excess skin is trimmed away. The incisions are then closed. An alternative technique for individuals who require less skin reduction is to use shorter incisions at the temples. The midface may be lifted through an incision within the lower eyelids or inside the mouth under the upper lip. Following the procedure, sutures, skin adhesives, tapes, or clips will be used to close the incisions. Your face may be loosely bandaged to minimize swelling and bruising, and a dressing may be worn to gently support the new facial contours as they heal. A thin tube may be placed under the skin to drain any fluids that might accumulate. Bruising, swelling, soreness, and numbness are all common side effects with facelift procedures. Any discomfort or pain you feel can be controlled with medication. Skin may also feel more firm than usual, and incisions may become itchy as they heal. Some facial movement may be also temporarily impaired. As with any surgery, possible complications may arise. These include areas of temporary hair loss or numbness within the scalp, poor healing at the incision sites, and bleeding beneath the skin or hematoma. Skin loss, irregular or raised scars, temporary or permanent facial nerve damage, and infection are less common. The use of anesthesia in any procedure presents its own risks. Facelift patients are usually released to go home within a few hours of surgery. However, sometimes an overnight stay is suggested for your comfort and to allow monitoring of your situation. You should keep your head elevated at all times until initial swelling subsides. A return to light, normal activity is usually possible within a few days of surgery. After 5 to 10 days, swelling will diminish rapidly, and any sutures or clips will be removed. You should be ready to return to work and regular activity at this time. Healing will continue for several weeks as swelling resolves completely and incision lines continue to improve. Diligent sun protection is recommended until the healing process is fully complete. This is especially important if you have had any resurfacing procedures. While they are long-lasting, the results you achieve are not permanent. You will continue to age naturally over time. However, most patients find that the benefits of their facelift last for many years. It may take up to 6 months for incision lines to fully improve, but your new, more youthful and alert appearance will be apparent immediately. The positive, energetic outlook you feel inside will once again be reflected on your outside.